Good morning, everybody. Thanks for joining us. My name is Brad Forney, president of BCF Group. Appreciate you taking some time to be with us this morning. We're here to talk a little bit about healthcare plans and how we create a better future for your healthcare plan and for your people and for your organization. And this is something we've been doing with a number of our employers. It's something we're really excited about. We're at a point in time we've never been more excited about what's going on in healthcare, and that's pretty refreshing because for a long time it's not been real encouraging. But there are opportunities now to change the course of our direction moving forward, and opportunities we've never seen before. And so it's been really exciting for us. We want to share a few thoughts and ideas with you folks and about what we're doing, and maybe they can be of help to you in some way. So, anytime is a good time to start charting a new future for yourself and your healthcare plan and making a new way. I think especially right now, we're at a key moment in time. And what I mean by that is that, we're starting to see here in 2021, we're starting to see inflation. And so making the best use of our healthcare dollar is even more important. And with COVID the past year, there's been a disruption in healthcare. And so virtually all of our self-funded clients have experienced significant reductions in their healthcare spend the past year because people aren't getting things done. They weren't going to do things during COVID. And of course, there's discussion and debate about the boomerang effect of that. Is that going to come back around, of course, and we're just going to have to pay for it later? Maybe so. That's a great question. But nonetheless, there's been a disruption in the way people buy their healthcare. They have done things they haven't done before. They're doing virtual visits. They're thinking twice about what they're getting done. And so there's just this thought interrupt, this pattern interrupt for people, which creates opportunity, creates an environment for you to make a change and do something different moving forward to chart a new future for yourself. So we think especially here in 2021, we're at a great time, we're at a critical time that you can begin some initiatives, begin a new strategy to change and reshape your healthcare culture and your organization. So we're going to talk about that some today. And when you think about that, when you think about creating a different, better, new healthcare future for yourself, you're really talking about going against the status quo. That's not been the status quo. Status quo has been the opposite of that. It continues to get more expensive and more of a burden on families and organizations. So you're really resisting the status quo. That's what we're talking about when you talk about creating a different healthcare future for yourself. It's going against the trend. So if you just think for a moment a little bit about what some of the trends are in healthcare, and you think about some really fundamental things like, well, what has happened to deductibles for everybody over the last 5 to 10 years? And if I was going to graph those for you, that graph is going to look something like this right here. They've been going up substantially. Over the last 5 or 10 years, deductibles have gone up quite a bit, and everyone is experiencing that. And if you think about what employee deductions have done over the past 5 or 10 years, how much people are paying out of their paychecks for their health care, that graph is going to look very similar. This is what has happened to it. Okay, so what we're paying and what we're getting in our deductible is going up, and our costs are going up. Employer costs, same graph. Employers are spending more on their health insurance, or employees are getting less. And so that's a problem. And if you want to create a different future, you have to interrupt your thought. You have to change your mindset, and you have to think a little bit differently, and you have to go against the status quo. And so if you think about that for a minute, if you can begin to chart a different future for yourself and just bend the cost curve a bit, keep it from going up as much, that graph is going to look something like this. And this spread right here, 3 to 5 years from now, is going to have a pretty significant impact on your organization. If you can do this, 3 to 5 years from now, you're going to be in a much better place. So you're going to have an impact on your organization. And it's interesting, a lot of people we talk to, oftentimes their first thought is, well, our healthcare plan's going okay. We didn't have to raise deductions too much last year, and we only changed our deductible once in the last 3 years. And so they have this thought pattern, this thought process about we're doing pretty good because we haven't had to increase our costs that much. And I'd like to try to stop that thought process in your mind. I'd like you to think a little bit differently. If you can pause for a moment and just think about what a future healthcare plan could look like. What may it be like at some point, or what could it be like for you? And think about things going the other way, not just bending the cost curve, but fighting the cost curve, going the opposite way, lowering deductibles for employees, lowering weekly contributions from your employees, lowering your overall spend as an employer. If your graph looks something like this, or you begin to go the other way, I would describe this first change here as having impact on your organization. I would describe this right here as incredibly life-changing. This is going to change life for your organization and for your people and your team members that are a part of it, and their families as well, if we can get there. And that's a vision that I think we have to grasp. We have to start picturing a better future for ourselves and not just accept the status quo. There's another interesting graph to look at, and that is what has happened to healthcare organizations' profits over the last 10 years. Hospitals, pharmaceuticals, large insurance companies, et cetera. Well, their graph looks like this as well. Their profits have gone up, our costs have gone up. And so we need to stop this thought process of accepting the status quo and start to picture a better future. I'd like to get my deductible down. I'd like to reduce it. I'd like to reduce my weekly contributions for my people. I'd like to create a future where they can get their health care and it hardly costs them anything. And if you think for a moment about what that might do for you and your organization, all the people involved and attached to your organization, and the social dividend that creates, the impact on families, the impact on profits in your organization, and what you can do with that, and the difference you would have as an employer. Folks that come to you have little or no deductible, pay little or no weekly deductions for their healthcare, and get great healthcare. Would set you apart substantially from your competitors. And so it starts with a vision, really. It starts with seeing, what my future could look like. And so the questions are then, well, how do I do that? And what does it take? First, it starts with a vision, and you got to see a better future for yourself and grab a hold of that vision. If you asked, what does it take and how do I do it? There's short answers to both of those questions. What does it take? It takes courage. You have to have a desire for a different future, and that desire has to be strong enough to break your thought process and break the cycle that you're on. All the standard options from all the standard players. How do we get there? How do you actually create a better future for your healthcare plan? The short answer to that is you do it step at a time at a pace that's right for you. And that's different for every organization. And, that's something that, oftentimes we hear from employers as well, is that, well, I want to create a different future. It just seems like it's going to be complicated. It's going to be hard. It's going to be a burden. It's too much change. Well, the way you do it is you do it step at a time at a pace that's right for you. And so that might mean incremental change, over the next 3 to 5 years, but 5 years from now, you're in a substantially different spot than you would be if you stay on the track you're on. And so the short answers are, it takes some courage. You have to have a desire to be different. And secondly, how do you do it? You do it step at a time at the right pace. And you know your culture, you know your organization, you know your people better than anybody. And so you really set the pace on how that happens. So there's a process to changing your healthcare future, to reshaping what your plan looks like and how it impacts people. And we'd like to talk about that for a few minutes. So there's a number of ways you can break down your healthcare dollar. I'm going to put it into 4 different buckets here today to talk about. You can dice it further than this if you want to, of course, and we often do. But there's kind of 4 basic areas that your healthcare spend goes, where your dollar goes. You buy insurance. Okay, so that's a piece of your dollar, is to buy insurance. Secondly, your prescription drug costs. And that's typically 20-25% of an employer's spend on healthcare, and rising right now, continues to rise. So that's a second piece. Third piece is your primary care. And we're going to touch on that just a bit. And then fourth is your professional fees and your facilities. And these are high-end costs from hospitals and other facilities and specialists, et cetera. And so your dollar gets divided. It goes to these different places. And I'd like to just break it down in those 4 compartments, just touch briefly on, what do we actually do to create a better future and get you to a place 3 to 5 years from now that you're not going to be if you stay on the track you're on. So first of all, insurance. And there's a fundamental theme to all of these things that we talk about here in these 4 areas. And that underlying theme is control, gaining control of your healthcare spend. So getting yourself into a position where you can make some intelligent decisions about where your healthcare spend is going and what you're doing with it, and just simply make better decisions about things, and your people can make better decisions. You need to be in a position of control. And so there's kind of a theme to that in the steps we talk about here to get to where you want to go. So with your insurance piece, we think you need to be self-funded. We're frankly not big fans of insurance, and we think you should buy as little of it as possible, minimize that purchase. And so self-funding allows you to do that. You buy a catastrophe policy and you minimize your insurance spend immediately when you do that. You also create transparency. You start to see where your dollar is going, and like I said, you can make better decisions about it. But a little deeper than that, than just simply getting into a self-funded arrangement, is that you need to align yourself with the right kind of partners. And what I mean with that is you want to get into an environment where the people you're working with, the organizations you're partnered with, have a similar vision to you, that they want a future like you want. They want to see you have a lower deductible. They want to see you have a lower spend. They want to see your cost minimized, and that money passed on in a social dividend in some fashion. And that's not easy necessarily to do in the healthcare environment. It's a bit tricky. The healthcare industry, insurance companies, even healthcare providers, they're very good at marketing, spend a lot of money on marketing. And so a lot of what we see coming out of kind of the traditional players in the marketplace, large brokers, TPAs, et cetera, is really the same things repackaged with a little bit of window dressing to make people think it's going to really have an impact on their health care. And I would encourage you to think hard. This is not easy. But when you look around, you want to find a partner that has a similar vision for you in your future. And the healthcare industry wants to increase their profits, not decrease their profits. And that generally means they're on a different course than you. They embrace a different vision than what you have for your future. And there's a couple of key points that we suggest people look at when they are considering a partner to place their reinsurance with. And those two things are transparency and exit penalties. So transparency, what I mean by that is you want to know what the revenue streams are. The revenue streams should be transparent. Transparency builds trust. And when everything is out in the open and you see how these players are compensated that you're dealing with, you begin to understand what their objective and their vision and their motivations are. And so one is transparency. You want to know where all the revenue streams are in the arrangements you have in your self-funded placement, your placement of your reinsurance, and partnering with the people that are setting it up for you, your TPA, et cetera. And then secondly is the exit penalties. There's a lot of kind of different self-funded options out in the marketplace, larger group plans, consortiums, things of that nature. And you have to be careful. You want to know, are those players aligned with me? And a great question to ask is, what are the exit penalties? And a number of those have very stiff exit penalties that once you get in, are very difficult to get out of. And so those two key factors, transparency and exit penalties, great questions to ask when you're thinking about aligning yourself with a reinsurance partner, a TPA, et cetera, to set up your self-funded program. If you think a little bit about what I said earlier about the underlying theme that you want to create in your plan, this foundation is a foundation of control. If you're in a program that has stiff exit penalties, who is really in control in that environment? It's not you, it's them. And you're in a spot you can't leave. And those exit penalties are there for a reason. It's to get you in and to keep you there. And so if you're aligned with a partner that doesn't see a future like you see, and they have a stiff exit penalty, that can be a problem for you. And so be careful when you begin to make a decision about who you place your reinsurance with and who you align with to set up your self-funded program. We think like-minded people joining together is the answer to that. And so what I mean by that is that we think you should place your reinsurance with a captive organization, an insurance company that you and your fellow business people own together. And so you should band together both locally with employers here in our territory and nationally. And you're partnering then with other organizations just like you that are trying to create a better healthcare future and want to see the numbers go down and have some substantial impact in their organization. And you're in the best position to do that when you're placing your reinsurance in an insurance company that wants to see costs reduce and wants to see premiums go down, not up. Aligned partners, very important foundation. So we think that's, you place your reinsurance in that kind of environment with a like-minded partner, and that's a foundational piece to creating a better future for yourself. And now you're in a seat of better control. Then the next three areas we talked about, your prescription drug spend, your primary care, and your facilities and professional expense. Those, of course, are your healthcare dollar. Those are what you're paying to engage your healthcare for your people, to access healthcare. And I'd like to just touch on each one of those very briefly here. Your prescription drug spend. Prescription drug is 20-25% of your spend and growing generally. And there are lots of hands in the till in your prescription drug spend. That's why it's expensive. And so there are some very simple things you can do to have a substantial effect on your drug spend. Not limit your drugs, just simply buy your drugs more effectively. And we do that through independent PBM contracts that are transparent and have pass-through arrangements so that you're getting the rebates and not someone else. And there's alternate sourcing you can use for your high-end drugs that make a substantial impact in what you pay for your prescriptions. We were meeting with a client recently, reviewing their numbers from last year, and just these couple simple changes on their prescription drug spend saved them a couple $100,000. So these are very impactful things. About 20 or 25% of your healthcare spend, you can make a change, and you're not refusing care to your people. You're actually getting it to them. Oftentimes, you pass along that savings and say there's no copay. Your employees use this program, they're going to get their drugs, and they're going to get them for a lot less. You're going to get them for a lot less. They might get them for free. And so that's a step in the process. Let's get something in place for your drug spend. Secondly, primary care. So primary care, your primary care doctors and physicians, your family doctors, that is the most cost-effective form of healthcare there is in the system. Okay. And it's interesting because over the last 20 years, hospital systems have bought up many of the family practices around the country. And that's very strategic on their part. A couple things about that. One, your primary care doctor is your doorway into the healthcare system. That's where most people start. They don't feel well, something's going on, they call their family doctor and go see the family doc. And so it's the entranceway, if you will, into a very large healthcare system. And hospital systems control that doorway right now in a large way. And what they've done with that is they've reduced the amount of time you spend with your primary care doctor. Generally, it's to 3 to 5 minutes. We call it the doorknob visit. The doctor rarely takes his hand off the doorknob because he's hardly with you. And that's very strategic by the healthcare system. They don't make a lot of money on primary care. It's the most cost-effective form of care there is. They want to move you out of there as quickly as possible and into a much higher cost form of care, which is where there's much more profit. And so we've done a lot of work in central Pennsylvania here and surrounding area with direct primary care doctors, which is a different model for primary care. These are doctors that have left the system and have engaged with their patients one-on-one for a monthly fee. And they provide all of your primary care for a flat monthly fee. And so then there's no other strings attached. There's no barriers to care. Your people can go to the doctor whenever they want to for as much care as they want. And it begins to cut in to the amount of time they spend with specialists and other high-cost facilities. Instead of going to the emergency room on Saturday afternoon to get stitches for their son or daughter, they call their family doc, meet them there. They have access to their doctor through their cell phone, text, email, cell phone call. Doctors available to them, and even some will make house calls. And so the level of care goes up substantially. And you now put control back into the hands of the patient and their physician about what happens next. And so that doorway into the healthcare system now rests with the patient and with his doctor. And that's important, getting that piece of control back. So primary care, we look at that and we see about putting that kind of program into your plan, again, to create a better healthcare future. And then thirdly is your professional and facilities costs. And these are high dollars, okay? Hospital charges, specialists, surgeries, et cetera. These things are high cost items. There are a number of things we can do to address this spend in your healthcare plan. We can use narrow networks. We can engage with RBP providers, reference-based pricing providers, direct contracts, community-owned health plans, et cetera. BCF Group is committed to innovation in this arena, just like we are in each of these other areas. And by charting a different path to address these costs, piece by piece, putting things in place at a pace that's right for you, you can create a much better healthcare future for yourself. Any questions? If you do, you can go ahead and throw them up in the Q&A. Glad to answer them. A lot of people ask, well, what do I do about this? What's next? We always say it starts with a conversation, charting a different future for your healthcare plan and for your people. It starts with a conversation and some education. And, I don't know if we can help you or not here at BCF Group. Maybe we can. We'd love to if we can. We're consultants. We're not peddlers of insurance products. And so it just starts with a conversation. Let's talk about what your future looks like and what it could look like, and what might you have to do to get there, and what would a 3 to 5 year plan look like for you. And, for as much as organizations spend on their healthcare and will over the next 3 to 5 years, 30 to 60-minute conversation to talk about your strategy, we think is a great investment. From there, we can see, can we help you? Is it fit for you? What pieces fit for you? What would it look like for you? And you decide, again, at the pace at which you want to go. But we would love to have a conversation with you and talk more specifically about these steps and what they might look like in your organization. Looks like we maybe have a question. Okay, a question a little bit more about self-funded partners, and can I share a little bit more about what a captive is and how it works? Great question. So a captive is just simply a small insurance company that employers start and go together and form, and they have ownership in it. And so what really happens with your claims dollar, your healthcare spend, is we divide it into a couple different buckets. There's small claims, which you pay yourself by buying a self-funded policy, a stop loss policy that has some kind of specific stop loss to it. And so you're going to pay the small claims yourself. But then instead of having the insurance carrier take over after your small claims have been paid, we create a second layer of claims that you can partner with other employers to fund and mitigate that risk collectively. And you use your buying strength to do that, and then buy a catastrophe policy with that buying strength to take the third level of claim, which are really your catastrophe claims. And so that insurance company, now you're not just paying your small claim, but you're also a part of an insurance company that is with like-minded employers from locally here and around the country that all have the same objective. They want to lower everyone's premium. And that's the opposite of what the healthcare system is doing, what insurance companies are doing. And so that's very briefly what a captive is and how it works. Okay. I want to say thank you to all you folks. Thanks for being with us, taking some time to participate, and we're grateful to share this information with you. We'd love to chat with you. Feel free to reach out to us and any one of our team members, and we'd be more than happy to just have a conversation and see what your future might look like. Thank you.